So, my name is Mohamad Azizol bin Abdul Wahid and I am from SMK Geting. I really wanted to become a psychiatrist since I was Form 2. My first question about a psychiatrist is, what is the pathway of becoming a psychiatrist?
Okay. First, you have to be excellent in your SPM, of course, and then you can enter your matriculation or any foundation course for about usually 2 years kan, but some matriculation only for 1 year, and then after that you can apply to be in medical school, any medical school either in Malaysia or overseas, and it take about 5 to 6 years depending on which university you study. And then after you get your degree in medicine, as a doctor in medicine, you can enter your housemanship. Usually housemanship will last about 2 years. After that, after your housemanship, you will become a medical doctor or medical officer, which I think about 3 years after that you can apply for your master in psychiatry in local university. The master program will be about 4 years. And then if you able to complete your master program in time, which is 4 years, you will become psychiatrist. So total about 9 years to become a psychiatrist. The earliest about 6 years. And that's another pathway to become a psychiatrist apart from the master program. After you complete your housemanship, you can sit for exam. The exam is actually from Royal College of Psychiatrists UK. Which you have to pay by yourself, and you can sit for I think 2 or 3 exams, and usually they will take about 3 to 4 years also, and after you pass all the exam you can also become a psychiatrist. And actually to be a registered psychiatrist you have to undergo what we call gazettement period. Usually about 6 months for those graduated from master program. But if you graduated from the other pathway, what we call parallel pathway, the gazettement period is actually 2 years. So it's a bit longer compared with those who graduated from master program.
Oh, I see. So there's a lot of pathway and it's a really long journey, right?
Yeah.
As I know that a doctor have their own subspecialty. For the psychiatrists, what are the subspecialty for them?
Okay, to name a few, there's child and adolescent psychiatry. They deal with, of course, children and adolescent, like all the school children. And we also have community and rehabilitation psychiatrists. The community and rehabilitation psychiatrists usually handle the patient, see the patient in the community, and they also involved with the rehab program so that our patient can contribute to the public, they can work, at least they can take care of themselves. That is under community and rehabilitation psychiatry. We also have addiction psychiatrists. Addiction psychiatrists actually they handle those who has addiction problem, those who involved with drug, pil puder, ganja or something like that. That is under addiction psychiatrist. We also have forensic psychiatrists. Forensic psychiatrists usually in hospital, what we call as mental institution. I think you heard Hospital Tanjung Rambutan.
Yes.
But the name now is actually Hospital Bahagia Ulu Kintab. So the forensic psychiatrists will be there and they handle cases that involve legal issues. For example, when a psychiatric patient injured another person, they will be sent to the Hospital Bahagia Ulu Kintab for the assessment. We have to make a decision whether the patient is mentally ill or not when they did the action. That is under forensic psychiatrist. We also have psychogeriatrician or geriatric psychiatrist. They deal with elderly patient, those whose age above 60. Usually those who has memory problem, what we call dementia, or in bahasa Malaysia we call nyanyuk. That is under geriatric psychiatrist. we also has liaison psychiatrist. Liaison psychiatrist is a field of psychiatrists dealing with other area of medical such as surgical, orthopedic, pediatric. If they have any issues during admission to ward, some patient will become confused, will be shouted in ward, so they refer to our liaison psychiatric team.
Well, by hearing what you say, there's a lot of such specialty, and I think the forensic is sound good.
Yeah.
What about the personality? Is the personality is a good trait of becoming a good psychiatrist?
Okay, it's actually there's no specific personality trait to become a psychiatrist, because when you enter the master program, you actually will be trained how to become a good psychiatrist. They will teach us how to get history, get the story from the patient. They will teach us how to detect a patient who has abnormality. They will teach us the soft skill, how to talk, actually how to handle stress. They will teach a lot of things during the master program. So because personality, actually we can change our personality depend on whatever life experience. We can change ourselves. So it's not fixed specific personality who is suitable to become a psychiatrist. Actually the main point is actually to become a psychiatrist, you has to be somebody who want to help others. We have to show our empathy to our patient. That is, I think, the main contributing factor to become a good psychiatrist.
Oh, I see. So it means that when I undergo to the master, I will have a lot of things to learn, especially for the personality, right?
Yes.
And for the last question, I want to ask: is there a difference between the government psychiatrist and the private psychiatrist?
Okay, if we talk about Kelantan specifically, there's actually no private psychiatrist in Kelantan. We have psychiatrists in this hospital, my hospital, Hospital Raja Perempuan II. There's also psychiatrists in Hospital Tanah Merah and also Hospital Sultan Ismail Petra Kuala Kerat. And we also have psychiatrists in USM, Hospital USM. But in Lembah Kelang, there's actually quite a number of private psychiatrists in Lembah Kelang, in KL, Selangor, and also I think in Perak also there's a few number lah, but not in Kelantan. Okay, so the difference is actually in private psychiatrists, they usually don't have ward. They only on the outpatient basis, meaning that if there is aggressive patient who's needed admission, they will refer to the government hospital to be admitted lah. So that is the difference between private psychiatrists and the government psychiatrists.
I see. So based on the discussion, I think I had learned a lot about the psychiatrist today. Hopefully, I can be a great psychiatrist as you. So thank you, Dr. Malihah, for spending your time with me.
Okay, thank you.
And hopefully we can talk more soon. So based on my discussion with Dr. Malihah, I think we have learned a lot of things, especially about the subspecialty. I really interested about the forensic psychiatry because as far as we know, when we talk about the forensic, we always think about the crime investigation. We didn't know that that in the psychiatry there's a lot of subspecialty, like that she already said about the child psychiatrist, about the forensic psychiatrist, and also about the addiction psychiatrist. And I hopefully think if one day I can become one of the psychiatrists in those subspecialty, at least I can give somebody hope, because to me the people that we call have the mental illness, they also have their rights to be to have a normal life like we as a normal person had been. Thank you.